A very good afternoon to everyone. My name is Sabia Arora, clinical instructor in Khalsa College of Nursing. Today I am here to discuss about a very common topic, respiratory syncytial virus, that is occurring in infants 24 months of age. This virus affects the lung and breathing passages. This virus spreads into the lower respiratory tract and this causes illnesses into the infants. It is a wide spectrum cause of many illnesses in the infants. 90% of all the infants experience this virus infection when they are below 24 months of age. So now we will discuss about some causes and risk factors of this virus. This virus spreads when someone is exposed to some environmental substances that develops the risk of developing this illness, or someone who is suffering in the family with this virus comes in contact with the infants. So therefore this causes the respiratory syncytial virus into the infant's body. Now we will discuss about how this virus spreads into the infants and older adults. As this virus is restricted to lower respiratory tract or respiratory system, therefore the inoculation of this virus starts from respiratory system. It affects the upper respiratory tract, then gradually it moves to the epithelial cells, and then finally this virus spreads to the lower respiratory tract, and furthermore it leads to pneumonia and bronchiolitis. So after that, as the virus has spreaded into the body, it shows many signs and symptoms. These symptoms may include cough, wheezing, sneezing, running nose, hyperinflammation of the lungs, pneumonia, low-grade fever, pneumonia, bronchiolitis, etc. So these are the main signs and symptoms of this virus. Other symptoms may include shortness of breath, difficulty in breathing, difficulty in sleeping, and unable to perform daily life activities. So therefore, to detect this virus, we have to go for some diagnostic tests. These tests includes serological test, in which we demonstrate the antibodies present in the serum. After that, we go for rapid viral antigen, in which we detect the antigens or viruses occurring in the body or that has spread to the body and how much extent they have spread to the body. After that, we go for virus culture. In this, we collect the sample and then we identify the virus. Then, when virus culture is collected, the HEPA cells 2 and Hel cells 2 identifies the formation of syncytial virus into the specimen. After that, we go for the blood test or some other test that identifies the spread of this virus into the body. So as we know, prevention is better than cure. So therefore, we must go for the preventive measures to stop the transmission of this virus into the body. Therefore, the foremost preventive measure we follow to prevent the spread of this virus is hand washing technique. Frequent hand washing slows down the prevention of this virus into the infant's body. Therefore, furthermore, avoid going into the crowded area. Avoid taking the infants to the daycare centers, especially in the winter seasons. Avoid crowded places. Minimize the number of visitors in the infant's room. These preventive measures helps to prevent the spread of respiratory syncytial virus into the body. Furthermore, medical treatment that includes to prevent the spread of this virus includes antibiotics, ribavirin, corticosteroids, bronchodilators, oxygen therapy, nebulization, steam inhalation, and respiratory support. And some deep breathing exercises helps to treat the respiratory syncytial virus that is affecting the infants. Now we will discuss about how this virus spreads into the body. So the mode of transmission of this virus is through droplet infection and direct contact. Direct contact means coming in contact with those who are suffering from RSV virus. For example, someone in the family is suffering from respiratory syncytial virus. The infant comes in contact with them, they are more prone to have the spread of this virus into their body. So the main symptom that appears in the infants, that is sneezing and running nose. Therefore, some must follow preventive measures to prevent the spread of this virus into the infants, as they are on the very critical stage of their development. Therefore, we must follow some preventive measures. This virus spreads into the lower respiratory tract and causes bronchiolitis and pneumonia. So there are many stages of this virus, especially the 3 stages I am going to discuss today. That is stage 1, in which the virus remains into the body up to 3 days and causes mild cold in infants. As the virus spreads, stage 2, that means wheezing cough and running nose and sneezing appears in the infants as symptoms. And after that, in stage 3, the children are more to have infections and severe illnesses that causes difficulty in their breathing pattern and shortness of breath. Therefore, they must take oxygen therapy, nebulization, steam inhalation to prevent this spread of virus and clear their nasal congestions causing due to this virus. I hope this topic enhances your knowledge regarding this topic more. Thank you.